Hi all, this is Professor Truelove's Concepts for Nurses series, and I am Professor Terry Truelove. And in this episode, part of the Orthopedic series, we will discuss joint replacements, amputations, dislocations, and sprains. Joint replacement is a surgical procedure in which a mechanical device, designed to act as a joint, is used to replace a diseased or damaged joint. The most commonly replaced joints are the hip, the knee, the shoulder, and fingers. The type of arthroplasty is called total knee replacement, which is the implantation of a device to substitute for the femoral condyles and the tibial joint surfaces. Many people who suffer from arthritis of the knees will need total knee replacement. Preoperative care also includes assessing for the contraindications, which include infection, presence of osteoporosis, inflammation, and comorbidities such as uncontrolled diabetes or hypertension, all of which can lead to serious complications. Postoperatively, the patient will be in a continuous passive motion machine, require hot ice or ice device, which alters hot and cold. The procedure and the CPM machine cause severe pain, so pain management will be required, as will frequent neurovascular assessments. Consider exercising, turning, coughing, and deep breathing to counter the immobility, and the patient may have a drainage such as a Jackson-Pratt or a hemovac. Amputation is the removal of a limb. Amputation may be surgical in nature, that is, elective, traumatic, and there are different levels of amputation that we describe by the amount of limb that is removed. Complications include hemorrhage, infection, phantom limb pain, neuromas, and flexion contracture. In the lower extremities, damage from things like an uncontrollable infection or diabetes or trauma may require surgical removal of part or all of the limb. Postoperative care includes monitoring vital signs, monitoring for infection and hemorrhage, marking the bleeding and drainage on the dressing to keep track of it, evaluating for phantom limb sensation and pain, and to elevate the foot of the bed to reduce edema for the first 24 hours only. Do not elevate the lower extremities after 48 hours. You should use a stump stocking or rigid dressing to prevent swelling, to minimize pain and mold the residual limb in preparation for prostheses. You should avoid using powder or lotion on the stump. You should keep the stump in an extended position and turn the client to a prone position 3 times a day, and begin pre-prosthetic care, that is, mentally, emotionally, and physically. Phantom limb pain is a frequent complication of amputation. In phantom limb pain, or PLP, the patient complains of pain at the site of the removed body part, most often shortly after surgery. This pain is intense, can be a burning feeling, a crushing sensation, or cramping. Some patients feel that the removed body part is in a disturbed or distorted position. Phantom limb pain must be distinguished or differentiated from stump pain because they're managed differently. You should recognize that this type of pain is very real, and it does interfere with the amputee's activities of daily living. Therefore, know that opioids are not as effective for phantom limb pain as they are for the residual limb pain or stump pain. Therefore, other drugs used to treat phantom limb pain include beta blockers, anti-epileptic drugs, antispasmodics, and sometimes the IV infusion of calcitonin. A neuroma is a sensitive tumor consisting of damaged nerve cells, which forms most often in amputations of the upper extremity but can occur anywhere, where flexion contractures of the hip and knee are the most frequently seen in patients with amputations of the lower extremity. So use a range of motion to prevent these flexion contractures. Use a trapeze and overhead frame to have the patient assist with movement, a firm mattress, and turning the patient over into prone position approximately every 3 to 4 hours. For below-the-knee amputations, prevent edema, do not allow the residual limb to hang over the edge of the bed, and discourage long periods of sitting to lessen complications of knee flexion. For above-the-knee amputations, prevent internal or external rotation of the limb, and place a sandbag, roll towel, or trochanter roll along the outside of the thigh to prevent external rotation. The patient should be helped to be made ready mentally, emotionally, and physically for the use of prosthetics. There are devices to help shape and shrink the residual limb and therefore help the patient adapt to the prosthetic. This includes wrapping in elastic bandages. The fitting of prosthetics requires a special type of care. A dislocation is a separation or displacement of the two surfaces of the joint, that is, the articulating surfaces of that joint. And this is an injury to the ligaments which surround the joint. Whereas a subluxation is an incomplete displacement of the joint surfaces. And this both happen when forces disrupt the soft tissue that surrounds these joints. A cardinal sign of dislocation or subluxation is asymmetry. That is, the contour of the affected body part has changed. There will be pain, tenderness, dysfunction, and swelling. Complications include neurovascular compromise, avascular necrosis, and open joint injuries. X-rays should be taken to determine if there's any joint shifting. Dislocations and subluxations are painful. Therefore, pain relief, joint support, and joint protection are indicated. You can actually pop the joint back in by something called closed manipulation of the joint. And it's performed to force the joint back into its original position. Open or closed reduction is done with a post-procedural joint immobilization. In other words, after I pop that joint back in, you need to immobilize the joint. That joint is immobilized until the soft tissues can heal. Strains, on the other hand, are excessive stretching of a muscle or a tendon when it is weak or unstable, and they're classified according to their severity, that is, first, second, and third degree strains. Management includes cold and heat applications alternating with each other, exercise, including range of motion, activity limitations on that exercise, anti-inflammatory drugs, muscle relaxants, and, if severe enough, that is, if third degree, even surgery. Sprains are the excessive stretching of a ligament. These are characterized by pain and swelling. The treatment for sprains includes, for a first-degree sprain, rest, ice for 24 hours, compression bandage and elevation, or ice. Second degree requires immobilization, partial weight bearing, as the tear heals, and third degree is immobilization for 4 to 6 weeks, and, if it doesn't heal, possible surgery. That does conclude this episode. I hope you learned a little bit in this episode, and I hope you plan to come back to listen to some more. If you are, we'll see you then. You take care.